Good morning, Dr. Wong and everyone. We are from Group 5, Section 1. The topic of our presentation today is about the real-time continuous glucose measurement. For the table of content, which consists of this introduction, importance of continuous glucose measurement, mechanism, strength and weakness, future view and conclusion. Now I would like to start with introduction. Continuous glucose monitoring can be done by using this medical device shown in this figure, which consists of three main parts, including a sensor, transmitter, and a monitor. This device is able to measure and deliver the glucose reading to a monitoring device for every 5 minutes, which means that it can provide a continuous glucose measurement throughout the day of the user. Now, I would like to briefly discuss about the glucose and the importance of glucose for our body. Glucose is an essential fuel of energy production for the muscle and other body organs, especially brain. Adequate glucose level is essential for normal brain function and survival. Moreover, nerve cell and chemical messenger need glucose to help them to process and transmit the information throughout our body. Therefore, there is a need to have a regular body check in order to know the actual condition of glucose level in our body and also help us to maintain our glucose level in a normal range. This is because a balanced glucose level is very important to keep our brain healthy, maintain our energy level and mood balance. So from this table, we can know that the range of the glucose level for people with diabetes and without diabetes. So now I would like to pass to Xingyan for the importance of continuous glucose measurement.
Since you guys already know the importance of glucose measurements, now I will proceed with the importance of continuous glucose measurement. Continuous glucose measurement is actually very important for one of the medical conditions, which is hyperglycemia. Hyperglycemia is a condition when your blood glucose level is higher than normal. It mainly caused by significantly lower blood insulin levels in your body because insulin functions to lower our blood glucose level. People with type 1 and type 2 diabetes are commonly face hyperglycemia. So, they require the continuous glucose measurements to allow closely track their blood glucose levels throughout the day and night, so they can review how the glucose changes over a few hours or days to see the trends. This can alert them for their food choice, exercise, and other aspects of diabetes management. This is very important because long-term persistent hyperglycemia can cause diabetic coma and lead to complications that may affect our organs, include eyes, kidneys, nerve, and heart. Besides, continuous glucose measurements are also important for unrecognized hypoglycemia. In opposite, hypoglycemia is a condition when your blood glucose level is lower than normal. Surprisingly, hypoglycemia can occur commonly in diabetes patients that treated with insulin. This is because their secretions of the counter-regulatory hormones like insulin and glucagon is severely interrupted after years of having diabetes. Because insulin and glucagon, due to the years of diabetes, they has been interrupted and cannot be released in appropriate amount that can return your blood glucose level back to normal. So, moreover, the epinephrine response, which can help to produce the symptoms that indicate the hypoglycemia, also being impaired. This will cause the diabetes patients are not able to detect the signs and symptoms that indicate hypoglycemia. So they require the continuous glucose measurements to monitor the glucose level so that they can be aware of the marked drop in the blood sugar level to prevent the hypoglycemia become more severe. The severe hypoglycemia can result in cognitive dysfunction, including obtundation and seizures. If prolonged, it can even lead to coma and death. Another type of the hypoglycemia that require continuous glucose measurement as well is the nocturnal hypoglycemia. Nocturnal hypoglycemia is low blood sugar conditions that occurs overnight. And since it occurs overnight, we are hard to detect it. And repeated long-term exposure to nocturnal hypoglycemia can burn our body counter-regulatory mechanisms that help us to maintain our glucose level. So we are required to record these dangerously low overnight blood sugar levels, which often go undetected. So we can take some proactive steps like ensure your insulin dose is not too high, taking carbohydrate before bed, or not miss out our dinner or snacks that we should have.
So furthermore, continuous glucose measurement is important for diabetic management because it provides continuous real-time information about the glucose concentration of the user. So based on the result, the factor which affecting the excursion of the blood glucose can be determined. The factor including food, exercise, and medication such as insulin. Therefore, doctor able to make a better decision based on the result for a better diabetic care plan for the patient. A better diabetic care plan with a proper diet, exercise, and medication able to help the controlling of the patient blood glucose level. Thus, this can prevent and reduce the risk of diabetic complication. The figure here is showing the example of the complication of diabetes mellitus, such as eye damage, permanent kidney damage, diabetic foot, peripheral neuropathy, heart disease, and cerebrovascular disease.
After knowing the importance of the real-time continuous glucose measurement, then we will now proceed to the mechanism of the real-time continuous glucose measurement device. So basically, in the continuous glucose measurement device consists of three main components, which is a sensor, a transmitter, a receiver. So sensors will be inserted into the subcutaneous tissue of the skin, or in other words, we call it as a hypodermis. For the transmitter, it's used to transmit the sensor data to the receiver, which is used to display the information. As you can see from the pictures on the right, it shows one of the examples of the device. So the black color is shaped like a mobile phone shape. It basically is the receiver. It shows the trends and also the graph of the glucose measurement. So, and there is a white colors. This white colors part there is basically is the sensors with the transmitter attached to the sensor. So before we go into the mechanisms, I would like to explain on the sensor structure. So the sensors, before the glucose interact with the electrode, it consists of two main layers, which is the semi-permeable membrane layers and also the enzyme layer. So for the first layer, semi-permeable membrane layers, it consists of multi-layers of chemicals to filter the glucose and to protect the sensor. The enzyme layer consists of the glucose oxidase, which is used to convert the glucose to hydrogen peroxide. The hydrogen peroxide will undergo oxidation to release electron. The electron will convert into an electrical signal that correlated the glucose level. So when there is high signal or we have a high number of electrons, that means that we have a high electrical signal, then it represents the users have the high concentration of glucose. So the electrodes have a thin layers, it usually made up of gold, depends on what type of device it will use to send the signal to the transmitter. So we'll pass the mechanism, explanation of the mechanism will be explained by the cell girl.
So this part will talk about the mechanism of this RT-CGM. So it is actually quite simple to use and only consists of a few steps in the mechanism. So firstly, as shown in the figure, a half-inch long needle, which is the sensor, is inserted into the skin and in contact with the interstitial fluid. So the glucose inside the interstitial fluid will penetrate through the semi-permeable membrane of the sensor and react with the glucose oxidase inside the sensor. So as mentioned before by Chewy, this enzymatic reaction will produce the hydrogen peroxide and it will react with the platinum inside the sensor to produce electrons. So this will generate an electrical signal as an input signal which correlates with the glucose level inside the interstitial fluid. And then this input signal will be converted into the glucose reading by a computer program. And then the transmitter that is connected to the sensor will send this information, which is the glucose reading, into the receiver, which is a handheld device as shown by Chui just now. And then these glucose sensor readings are updated every 5 minutes and are displayed in a clearly visible, it's displayed clearly visible in this form of graph as shown in this figure, so that the user is able to check their current glucose level, their historical level, as well as the trends of their glucose level, whether it is going up or going down at that particular time. Okay. So these are the commercialized RT-CGM system. So based on this comparison, all of the device has already equipped with the threshold alarms for alerting low and high level glucose for the user to detect the hyper and hypoglycemia so that the user can take actions earlier. Besides that, averagely the glucose data is updated every 5 minutes. Only one device is updated every 1 minute. And normally the sensor can be placed inside the body for around 3 to 7 days as approved by the FDA.
All right. After studying the importance and the mechanism of real-time continuous glucose monitoring, we know that every system has their own benefits and limitations. So now I will further discuss about the strengths of the RT-CGM. First, it is more convenient than the other glucose monitorings, since the wireless RT-CGM receiver can be kept within 5 feet from the body. The RT-CGM requires only few finger sticks per day to capture glycemic variability. Furthermore, it is a safe, relatively accurate, and easy-to-use system. It is also able to monitor the blood glucose fluctuations. The RT-CGM can show the blood glucose fluctuations in a real-time format. This system also equipped with predictive alarms to let the user know if they are going to be outside of their target range in a designated amount of time, or if the blood glucose is changing too rapidly. The alarm is in a real time. The studies have indicated that using the RT-CGM is beneficial in detecting nocturnal hypoglycemia, and also it is better in determining asymptomatic hypoglycemia. Asymptomatic hypoglycemia refers to the low glucose without any symptoms. Next, the RT-CGM can provide the patient and their providers with information about hidden problems. The hidden problems such as the glucose and variability and also the glycemic response to different foods can be provided by this system. RT-CGM makes these problems visible by allowing the insulin doses to be adjusted to optimize diabetes control. Not only improves the metabolic control, RT-CGM can also increase the motivation and also facilitates the treatment. So now I will pass to Majid to discuss further about the weakness of the system.
All right, thank you, Ainin. Actually, even there are a lot of strengths for this kind of technology, there is still some weaknesses. And the first one actually is a side effect of during the usage. Some patients, they complain that they are not so comfortable when they use a sensor, and they cause them like a skin irritation. Besides that, there is some lagging time between the real blood glucose and the measurement that the technology provided. And that's happened in when we have a quickly change, actually. Like, for example, if the patient eat sweet, or when the patient go and do an exercise or something happen with them. So this quickly change, this kind of technology, it cannot detect it directly. So we have some lagging time with around 12 to 15 minutes. Besides that, also, this kind of technology need calibration. by the self blood glucose monitoring SPGM to 2 to 3 times per day to ensure that it provides an accurate and an efficient result. And finally, some studies said that there is low sensitivity for, especially for hypoglycemia, for this kind of technology, but they mentioned that it's totally based on the electrode types. And now, after we know the weaknesses, let's move on to the challenges during the usage of this technology.
All right, so I will going to talk about the challenges in monitoring the continuous glucose measurement. So first of all, is the patient level of the numeracy and the literacy. So basically, level of the literacy and numeracy in people with diabetes will impact significantly on the ability to interpret the trends in the numbers and their significance of the CGM. This is because the typical CGM device generates a value in milligrams per deciliter every 10 minutes, or roughly 300 times a day. So without specific and thoughtful dialogue and an assessment of the patient numeracy, potential remediation and education opportunity can be missed. Next will be the development of the alarm fatigue. So the CGM device is designed to alert user to the changes in the glucose level. And the alarm and alert can be programmed to a sound when absolute glucose thresholds are breached or when the rate of change limit are exceeded. So most of the alarm can be silent by the user, set to vibrate or turn off entirely. So when an individual experiences the frequent alarm, he or she may silence the alarm, change the parameter in favor of higher and lower glucose level, or even worse, they will ignore them. So this makes the difficulty in monitoring the continuous glucose measurement. Well, the third point is the interfering substance leading to the erroneous reading. This is consistent with the non-generation of a non-glucose signal by the paracetamol phenolic moiety oxidizing at the sensing electrode. There is also ascorbic acid and salicylate injection and others causes of in vivo measurement error, including the lag time between the capillary blood glucose and the interstitial space, trauma at the site insertion, changes in the perfusion at the sensor site, and physical pressure placed on the sensor. So all this will lead to the erroneous reading to the continuous glucose measurement. Next will be the high rate of the discontinuation. According to the result of the survey, they said that there is the technical problems with the device causes the discomfort. There is 42% of the user feel that it's discomfort when wearing the sensor. 33% of the reported problem inserting the sensor. 30% had problem with the adhesive. 28% had problem with the sensor working properly. 27% of the user experienced too many alarms. 25% of the patients were concerned with the accuracy of the CGM data, and 18% complained of the interference with the spot and the skin reaction. Last but not least, is due to the poor reimbursement. CGM has remained non-reimbursed by Medicare. Furthermore, there is additional challenge include the sensation of coverage in individuals already on the CGM who cross into the Medicare age group or those patients who are on dialysis. These two groups of the patient will essentially need to discontinue their use of the CGM. Next, we will further discuss about the chance of Commercialize by Axel.
Hello.
Just before, just
Can you hear me?
Yes.
Okay. For the real-time continuous glucose measuring, there are some existing devices in the market. Those devices are already approved by Food and Drug Administration, the FDA. I'm going to show some of those devices. First, we have the Dixon company produced G6 continuous glucose monitoring system, which contains an auto applicator, sensor, transmitter, and display device, as we can see from the figure shown in the slide. Another device is Abbott's Freestyle Liver 2 system. We can see it here. This device actually is suitable for children. Also, there is a device produced by Medtronic company. We can see it in the next. Can you pass the slide? Yeah. The Medtronic company device called the Guardian system, which has the sensor, transmitter, and the application in the phone to display the data. And also the data can be saved and reported so that the patient can refer to it. At the end, we can see that the system used to provide continuous glucose measurements consists of sensor, transmitter, and receiver. And actually, the future of testing blood sugars for patients with diabetes looks very bright. We can see also the near future will bring the updated version of this system to the market, as well as there are already existing manufacturers that there is going to be an improvement in those devices. That's all from us, and thank you.